everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you. With red light therapy or photobiomodulation, you're using certain kinds of light that is absorbed by your cells, and they use that to heal.
Welcome to Petability. I'm your host, Kathy Simon, certified veterinary technician, certified canine rehabilitation practitioner, and certified hospice and palliative care technician for pets.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Good afternoon, Kathy. I know we're both recovering from some post-holiday illness that's going around. How you doing?
I think we've moved into the season of 2026 with the flu.
Well, yeah. So it's definitely going around this year, but off to a good start with our first guest of this new year. Person that's returning, Alon Landa, the CEO of MedcoVet. Today, we're going to be talking to him about using red light therapy and specifically the Luma that MedcoVet manufactures to treat arthritis. So a little bit of a different slant than past shows. Alon was on in June of 2020, talking to us about the merits of red light therapy, photobiomodulation, cold laser, whatever you want to call it, and then did a bit of a comparison between devices and helping our audience know what to look for when they're shopping around, what the options are in this space in May of 2023. And it was called The Good, the Bad, and the Ugly when it comes to red light therapy. So anyway, excited to have him back.
Anytime we have a guest back a third time, I think they're a slam dunk. They're always a great interview when we have somebody back 2 or 3 times, like Alon and Dr. Silver. So I'm excited to talk to Alon as well. You know, when I'm thinking about arthritis and red light therapy, and we were just talking about it and how far we've come in treating osteoarthritis in animals. And I can remember a time when I first started as a technician that the treatment for osteoarthritis for animals was, here's your, non-steroidal anti-inflammatory drug and, good luck to you. Let us know when your dog can't walk anymore. So it's exciting that we have so many options now for treatment.
Right. Options and needed options. I mean, research has shown that it is best managed with a multimodal approach. And I think that sometimes people don't even realize what those various options are. And I think one of the cool things is how much red light therapy has really taken off in the last 8 to 10 years, but more so and more so, as time marches on. And it's such a well-received modality, both on the part of the pets, because it's so benign and comfortable and so forth. And especially when they can get it at home, like what the MedcoVet Luma provides, and easy for the pet owner to engage and be empowered to help their pet in a more natural, holistic, sort of way.
It makes the pet parent part of the pet's healing journey.
Absolutely. So before we get too involved, I wanted to mention a little bit of sad news. In May of 2025, we published a show with Diane Morano, who had an extraordinary therapy dog that was involved in the emotional support for Sandy Hook and the Boston Marathon bombings and so forth. And at 13 and a half, I just learned that Toby passed this past week. But man, how many lives he touched and brought healing and light to those people. So I wish you well in your next journey, Toby.
Godspeed, little man. He did a lot of good things for a lot of people while he was here, and so did she. And I remember how passionately and lovingly she spoke of not only Toby, but their journey to helping people heal. So yeah, my thoughts go out to her as well.
Well, let's get back to the task at hand. So we said we're going to really focus on arthritis today and how red light therapy can impact that. And, arthritis, I guess I think of kind of two ends of the spectrum. In one sense, Kathy, we've talked in the past about people saying, oh, it's just arthritis. That's no big deal. It's just some joints, aches and pains. But truly, it is a debilitating disease. And we need to think of the joint as an organ. There are so many different types of tissues that are involved in that joint. And when you can't navigate your environment without discomfort and pain, that is a big deal. So getting that diagnosis is certainly not something that any of us pet parents want to hear regarding our pets, but unfortunately is very, very common.
Big quality of life issue for patients who have arthritis, especially in multiple joints, and that can't engage with their daily functions or their daily activities. And so, yeah, I wish people wouldn't think of arthritis as just arthritis, because it's not. It's a disease, and it can start a vicious cycle of inactivity and pain, and then that feeds on itself. So we're going to talk a lot with Alon today about these options for treating osteoarthritis and mitigating the damages from inflammation.
And at the other end of the spectrum from, oh, it's just arthritis, I did a little bit of research, and you know how I love my statistics. Arthritis leads to pain and suffering, potentially. Now, if it's screened for early on and proper management is initiated, dogs can live and our pets can live very comfortably for, many, many months and years. But arthritis and the pain and suffering associated with it is often cited as the primary reason for euthanasia. Yeah, like you said, it's a quality of life issue. It impacts everything. So without further ado, let's welcome Alon Landa back to Petability. Again, CEO of MedcoVet. Kathy, you and I have known Alon, I certainly have, almost since the inception of the company. And we both do some consulting for the company. So in terms of transparency, MedcoVet is one of the sponsors of Petability. We definitely believe in this product. And we would like you, Alon, to help us understand the science behind red light therapy, and specifically the Luma, and what it can actually do on the cellular level, and how it can help pets with arthritis move more comfortably and enjoy a better quality of life.
Yeah, I'm excited to talk to Alon too, and how red light therapy fits into a comprehensive arthritis plan, and what pet parents should realistically expect, and how to separate evidence-based tools from the hype, right? There's this hype, a lot of hype, right? And how do you wade through that? So please welcome back to the show, Alon Landa.
Thanks so much for having me back on. I can't believe it's the third time. It absolutely blows me away. And to be honest, I was listening to you guys in the introduction to the podcast. You have stolen so much of my thunder. You are so knowledgeable, both about MedcoVet and about arthritis. I'm really struggling to figure out what I'm going to talk about. Hopefully you guys will prompt me a bit, and you guys can get me rolling.
Absolutely. This is something that both Kathy and I have dealt with a lot as rehabbers, and meaning osteoarthritis. And it is so, so prevalent. But again, we just want our listeners to know that this, meaning red light therapy, and specifically the Luma, is such a viable option for treatment. And whether it's used initially, maybe even exclusively, or as an augmentation to other therapies down the road for latter stages of arthritis. So before we get too into that, let's have you explain in your words, what is photobiomodulation, just to review that for our listeners.
Sure. So when you talk about photobiomodulation, it's just a fancy word for saying you can use certain kinds of light to stimulate the cells. Now, if you think about it, that's kind of what medicine does. Like you take a certain kind of medicine and it does stuff in your body. And with red light therapy or photobiomodulation, you're using certain kinds of light that is absorbed by your cells, and they use that to heal. Now, we can go in one level deeper to actually what happens in the cell, but the bottom line is you can get your cells to do things to help you reduce inflammation, reduce pain, and that's exactly why it's such a great tool for arthritis.
Right. I always remind folks that, arthritis literally translated is inflammation of the joints. So really, you've taught me, Alon, that the number one thing that red light therapy does is reduces inflammation. So it can be effective at treating any itis, essentially.
That's absolutely true. It's what I think is really interesting is when you talk about inflammation, not all inflammation is bad. If you think about it, inflammation is how your body heals stuff. So think about if you cut your finger. If you cut your finger, your body is going to get a signal to say, uh-oh, there's a cut on my finger. I have to send all kinds of things there to clean it out and to build it back up and to restore it as fast as possible. That's the inflammatory process. That's a good thing. If you didn't have that, your cut wouldn't close. But things get a lot worse when you have chronic inflammation, like with arthritis, where the best way to look at it is like the fog of war. Like if you're chronically inflamed, your body is sending troops in there to clean it, and they're coming back and it's trying to repair it. And eventually the body doesn't deal well with chronic inflammation. And what red light does is it does two things. One, it signals the body to cool off and to stop sending that inflammatory signal. And two, it restores ATP, or the energy. And it gives the body the energy to actually restore itself back to normal homeostasis. So that's all really what red light does for the body.
We're stimulating that mitochondria, right,
Exactly.
of the cell to repair itself at a faster rate.
Absolutely.
So, Alon, what led MedcoVet to develop the Luma specifically for pets with arthritis and joint pain?
So I think you guys actually described it pretty well in the intro. The arthritis is a very prevalent condition. Like I think 1 in 5 dogs have it at any time. It's such a problem. And Chris described very well how it's treated. It's like, we're going to give you NSAIDs, like doggy Advil, until your dog can't tolerate it anymore. And then we'll figure it out from there. So it's one of those things that had a kind of good solution, but it just wasn't enough. And we've now talked to so many pet parents. They're really bent out of shape about this. They feel terrible to see their dog or their cat struggle to get up or to do all the things that they used to do. And even further, what Chris was saying, if you can catch it early, you can stop the slide into worse conditions. So we've seen an opportunity, if people take it seriously, not just to relieve the pain with NSAIDs, but to actually slow down the degradation of the joints. And so we said, there's a huge opportunity to offer better treatment. And the treatment we had was actually a home-based product. So we thought if we could make a device that's effective and safe at home, we could absolutely offer a better solution than just NSAIDs to relieve the pain.
I think also, Alon, as you're talking, it really speaks to the way that we've changed and developed our relationship with our pets. My whole being, every one of my cells in my body is taken up by Mac, right? And to see him struggle like that would be really painful. And to know that the only solution would be non-steroidal anti-inflammatory drugs would also be a painful solution for me. I wanted to see my young dog on a long-term non-steroidal anti-inflammatory drug. So we've changed the way we think about our pets, I think, over time.
So let me build on that a little bit. You're absolutely right. Pets are now family members, and you're totally engaged with them. The side effect of that is more conditions are going to the vet, meaning more surgeries, more just about everything that ails your dog is now going to the vet. And right now, veterinary clinics are completely overwhelmed. And if they have a choice between doing a life-saving surgery and figuring out the right dosage of NSAIDs, they're so overwhelmed right now that even the existing treatments of NSAIDs, they just aren't enough. The vets don't have time. And this is why not only did we bring it into the home, but we offer it directly to the consumer, where we bring in clinicians that are specifically there to help you get the right treatment. So it just gives every pet owner the individualized attention that they actually need.
Yeah, I think that's definitely a differentiator, with the MedcoVet Luma. If I'm correct, it's the only company that actually has an interactive, engaging, free app that goes along with the device so that protocols can be modified, questions can be asked and answered. You can upload pictures and video. And it is so helpful, I think, versus, maybe ordering a device on Amazon and not having any support whatsoever. It's like, good luck.
Yeah, it really does make a difference. And what we offer is a half-hour consult with a human being, because it's just so much better than, hey, my dog has arthritis. Okay, shine the light on their knee between 1 and 30 minutes and good luck. And I hope it gets better. And then some actually do. But there's so much opportunity to make sure there's no contraindications, to make sure that you're putting the right placements, that there are not other things going on. It really allows this treatment to be part of that multimodal treatment for the pet.
So with 40% of dogs having arthritis based on radiographic or x-ray evidence by age of 4, and 80% of dogs having arthritis by the time they're considered seniors, let's talk a little bit more about the pain management and how arthritis manifests in pets. And I'm particularly interested, Alon, in does this just mask the pain? The properties of the red light, you alluded to it earlier, in that it eliminates some of those deleterious inflammatory mediators, those chemicals that eat away at the joint. But it also, so for joint preservation, but it also brings in cells that help with healing.
So there's 2 ways you can deal with the pain associated with arthritis. The way that the pet is experiencing pain is by nerve endings being triggered, meaning they feel it in their nerves. And one thing you can do is you can block the pain receptors and they won't feel pain. That will make them feel more mobile, but that doesn't actually address the underlying condition. The other thing you can do is, especially in a chronic condition, a lot of the cells are constantly telling each other that there's an all hands on deck inflammation situation, meaning they're saying, hey, we got to go in there, we got to clean it out. Oh, we got to start building up the scaffolding to make it better. And all these cells are kind of fighting each other because it's not clear where the body is in the inflammatory process. And what the red light does is it actually reduces what's called the cell signaling, what they're saying to each other. And in essence, what it's saying is, hey, everybody, let's just cool off for a second. Let's slow down. Let's build up a little bit more energy and then just kind of slow down the whole inflammatory process and stop having the inflammation actually fight inflammation, which is causing a lot of the pain and the continued chronic inflammation.
Are you saying that red light therapy can actually delay the progression of joint degeneration?
Yeah, that's actually the beauty of this. By slowing down the inflammatory signaling, the stuff where the body is signaling to itself to continue the inflammatory process, you're actually you're delaying the process. What's happening under the covers is the body is sending things in there to actually clean out the inflammation. And it's actually cleaning out the scaffolding that it's building. So by slowing everything down, you're stopping the body from fighting itself and getting worse and worse and worse.
So Alon, I mentioned in the introduction too that there are so many devices out there now, right? This is such a popular modality. And the devices, somebody today told me that they found, quote, red light online for as low as $80. And the MedcoVet Luma is a higher price point. But let's talk about that. Let's talk about why that is and why the specs matter. And, what are the key things, especially as it is addressing arthritic changes.
So yeah, you're absolutely right. The Luma is more expensive. And I think it breaks down into a couple of things. Like, first of all, I think our device is better because when you think about pets, the real big difference between pets and humans is fur. And most of the devices on the market are human devices that they just say, oh, also works for dogs because the underlying mechanism of healing is the same. The problem is not much light makes it through the fur and to the target. So the first thing is we have a comb on the front of the Luma that gets through the fur, and that makes a massive difference in terms of outcomes. The second thing is we've spent a significant amount of time, both with Chris and Kathy's help, in researching all the different research out there and all the different parameters. And we've come up with parameters that meet the World Association of Laser Therapy guidelines. These are guidelines that have the highest chance of actually resulting in positive outcomes for most common conditions. And it's a really great piece of work. It's a combination of clinicians who are actually doing the work and researchers who understand like cell biology and things like that. But beyond the device, like I think we have a better device, but the real difference beyond what we call the flashlight is ours comes with support. When you sign up for a consult, we have somebody who actually talks to you and helps you figure out what's going on and how to use it and whether you're a good candidate, and then support you and modify the protocol as things progress. So you're not just getting a better device that meets industry standards, you're actually getting support so you know how to use it. And like Kathy said, when you're treating a family member, like, do you really want to save a few pennies and not get a great outcome? This is a comprehensive clinical grade solution as opposed to a device you could just buy on Amazon.
I want to go back just a little bit alone to treating the osteoarthritic joint. And I guess, I'd like people to think about just imagine in your head a Newfoundland and that thick, dense black coat. And sometimes even their skin is a little bit darker. And that's one of the challenges of red light therapy. How do I know how much light is getting to targeted tissue and how much is getting absorbed or scattered or reflected by that Newfoundland's coat? So I think the comb is key here for a lot of patients.
Absolutely. So they've done some research on how much light is blocked by different thicknesses and colored furs, and it can get up to 90% of the light is blocked by the fur.
Wow.
Which means if you're buying a device off of Amazon that could be, in theory, a reasonably good device for humans, and then you just put it up to exactly to your point against a Newfoundland's fur, you're really just irradiating the fur, and not much is actually making it to the knee joint where you actually want it to get.
I think the other thing the feature that I think is brilliant for the Luma is that you can actually increase the depth of penetration just by putting a little bit of pressure on the device. So when I'm thinking about an osteoarthritic joint of like the hip versus the knee, so some of my patients who are large, I just put just a little bit of pressure on that device. I can actually penetrate to deeper tissue, which I think is really helpful for our dogs that are super fleshy, if you know what I mean. Some of them are, muscles and fleshy, but you can get to deeper tissue.
I agree. And I would add one thing, like, let's say you're doing it and you're starting to see good results and then you plateau. The fact that you have a clinician who can then take a look at it and say, you know what, this is what we expected, or let's try and irradiate with longer time. Like instead of a minute, let's do a minute and a half. Or you go the other way where the dog starts to get better and is getting better and better, and then they plateau even a little bit later. And you're like, no, this is great. Let's actually slow down the number of treatments. We've kind of hit a good spot. Let's go every other day. So it just beyond I totally agree that pressure makes a huge difference. The support to help you know what you're doing and feel confident that you're actually treating within industry guidelines is actually huge.
Alon, I'd like to talk a little bit about timing. I guess one, how long does a typical treatment time take? I know that a lot of engineering went into the Luma to make the treatments very efficient for some of the reasons we've already mentioned, but also I think it's important to manage pet parents' expectations and that this process of decreasing inflammation and promoting healing doesn't happen overnight, that you need to be consistent with the treatments. And so pet parents need to really know what's involved in terms of their care, and do they have the time to dedicate to this? So can you talk about that?
Chris, I totally agree with you that the easiest treatment to offer a pet, although it won't last forever, is to put Rimadyl, like doggy Advil, in bologna and just throw it at them and have them swallow it up. And there's a beauty to that. It's pretty simple, but it gets to a point where the dog's liver and kidneys can probably not tolerate NSAIDs, and it's not great for them. It's much easier on the body, but to your point, it does take more time. Let me give you just a simple example. Like, let's say you have a dog with arthritis, and if they have arthritis in one knee, you probably want to treat both knees for compensation. So if you have a medium-sized dog, let's say, I don't know, 40-pound dog, you'll probably want to treat 3 spots per knee for about a minute or a minute and a half each. So that's 4.5 minutes per knee, about 10 minutes total to treat. And you would probably start daily for maybe a week or 2 weeks. And again, that's when a clinician would do an assessment and say, maybe now it's a good idea to taper off to every other day, maybe less spots per knee, things like that, less time per knee. So the idea is you probably have about 2 weeks of daily treatment, and then you kind of play it by ear based on how the dog or the cat responds.
It's not just dogs and cats that get osteoarthritis. And I think Chris and I covered this in a show that we did on osteoarthritis. But I've used the MedcoVet Luma for other species as well. I use it for chickens and ducks and geese, and even for some of my parrot patients. It's difficult when you're a 2-legged animal and you have arthritis and you depend on those legs for standing and you don't lay down, how important it is to have 2 functioning legs.
One of the things that's been so great is we've really tried to separate things that we know really well, like how to treat a dog with arthritis, and then things we want to learn about. And for that, we needed like a fearless pioneer to try things and to really take red light therapy to places it hasn't been, like with reptiles and ducks and chickens. And that person happens to be on this podcast. So Kathy's been working with MedcoVet. Every time we get an exotic where they're like, hey, we want to treat a parrot or a chicken with bumblefoot. And I'm like, I know what we do really, really well, but I'm willing to try new things. Kathy's always the one who takes the reins and goes out there and does a fantastic job.
Thinking about a patient I had last year, a little rabbit who I'd used the MedcoVet Luma for. And she was a very old rabbit. She was probably pushing up to 12, which is old for a rabbit. And she couldn't go to the vet. And she was just debilitating osteoarthritis. And for her owner to be able to do the Luma at home with her was so key, was so key. It's so frightening for rabbits to go to the vet. And it was so stressful for her to, travel. And then just to be able to do that at home. And then the response that she got from treatment was remarkable. So yeah, there's a lot of animals out there besides the dogs and cats that have osteoarthritis that can benefit from red light therapy as well.
I love the great outcomes, but we make a promise that we're going to be transparent, meaning we don't promise what we can't deliver. So there have been plenty of great stories where outcomes were great, but we like to start by saying, hey, these are the things that we're willing to be on the journey with you and try and figure out. And many times it ends up really great, but it's tough to give a pet owner false hope. So we always tell them where we are, and the ones that buy in usually end up having great results.
It takes brave people, clinicians like Kathy to try these things. And it's so safe that oftentimes the worst thing that's going to happen with treatment with red light therapy is that you're not going to get the results. But it's not going to cause damage. It plays so well with all kinds of comorbidities. I had somebody today asking me about their dog that may have Cushing's, different medications, other modalities in terms of, some of the things that we employ in rehab, like our physical modalities, massage, stretching, exercise, but then also things like PEMF therapy and ultrasound and e-stem and all of that. So it just has so much potential and very few precautions, and only one contraindication that I think we should mention. And this is also a great value to the consultations. I do a few of those consultations on behalf of MedcoVet, and I caught a potential cancer patient today. Do you want to talk about that alone and why we in particular screen for cancer?
So if you think about what red light therapy does, like I said when we started, it stimulates the cells. And what cancer is cells that are crazy overstimulated and growing like crazy. And the last thing that they need is a boost. We do not offer the Luma for cancer patients, for patients who are pregnant, because again, if you think about it, if you have a baby inside, the baby is just cells growing very, very, very quickly. The last thing you want to do is alter that, stimulate it in a way that the body doesn't want to be stimulated. So there are rare contraindications, but as Chris said, that's really the difference between just buying a device and having somebody who can help you think through it. Some contraindications are super obvious. Sometimes it helps to have an expert to say, hey, here's all the things that I see going on. Let's make an informed decision together.
I don't use it in dogs that are their growth plates are still closing.
Exactly.
I don't typically use that over there. And I had a patient the other day who was just on the cusp of them closing and they hadn't closed yet. And I said, I don't think you're ready. Let's go back to your veterinarian and talk to them about what's happening. So there seems like the contraindications are minimal.
Yeah, absolutely. Aside from the contraindications, we don't hurt the patient, but the people who are coming to us are people who have pets in pain, and it's a family member. And we take it so seriously that we want to help. Most times it works out great, but you just always want to, you want to treat them like a human being.
Well, let's talk about some of the positive outcomes. Kathy, maybe you and I can share some of our experiences that we've had in using red light therapy, whether it was, laser in the clinic or the Luma for at home. I think one of the main things that I'll see or that I hear reported, right? Because the pets can't talk to us directly. So we're really observing them for signs, positive change in terms of signs. And it's increased energy, getting the zoomies again, or the dog is up and greeting the pet parent at the door when they come home, and they hadn't done that in months because it was such a struggle to get off the floor. What kinds of things do you see, Kathy?
Well, as you know, I see a very fragile population of patients because a lot of my patients are end stage life or hospice patients. And so I have a lot of patients that cannot make it to the clinic for whatever reason. They can't get in the car. They're not well enough. Maybe it's too stressful for them, or maybe everything I do in rehab is going to be negated by this bad car ride home. And what I'm looking for oftentimes in pain relief with the MedcoVet is small gains. So these dogs are able to stand to eat, or cats are able to stand to eat, or cats are able to make it to the litter box, or dogs are able to transition themselves from left to right. And those may not seem like a big deal, but at end of life, it's a huge deal to have any type of independent movement or mobility, to make those choices, to feel good, to feel better, to have quality of life, or to have that mental well-being. So sometimes I'm looking for smaller things than I am when I'm looking at like my TPLO patients, right? So I could have a TPLO patient that comes in 1 week and is toe touching, and the next week it wants to run like, a 5K. Because it's feeling so much better. So I'm looking for small gains in a lot of my patients, but the impact is huge. These dogs or cats that are at the end stage of their life should not suffer. And this is something that the pet parent can do in their home and be a part of that end of life journey for their pet and making them comfortable. And it's so important. What a connection that is, right? What an experience that is to be with them at home and be part of that process.
I'm glad you mentioned that. I have a fairly recent client pet that I'm working with named Cooper, and the owner is really great on the app and giving updates and so forth. And she's describing these little things in kind of a, well, yeah, he can do this now and he can do that now. And I was like, oh my gosh, these are huge things.
Right.
So when we started, this has been about maybe 6 weeks now, Cooper cannot stand to eat his full meal.
Right.
Now he is. He is getting up from the ground quicker.
That's exciting, Chris.
Yes.
It's exciting.
She sent me, I think from like their Ring doorbell or something, video of Cooper running in the backyard and playing with the other dog this past week.
Right.
And, sometimes for the pet parent, these changes are so insidious and that they just, happen gradually, and, you're going through your daily routines. And so that's why I always encourage people, do take a baseline video, because, if a picture is worth, 100 words, a video is worth 1,000, and really see how they are moving, and do that periodically, because that will legitimately document these improvements that it's hard to remember. And that's what, the app with the MedcoVet Luma is so great at prompting as well. It asks you for status updates and very functional, types of things. I mean, inflammation, there's 5 components, and we talked about it addressing that. You have pain and you have mobility, but the other 3 are very hard to detect. And that's heat, redness, and swelling. That's happening deep within the joint. You can't, quantify that very easily. So we're looking for, again, these improvements in function.
Right. And I was thinking as you were talking, one of the things I'll do if I have the opportunity to do so is I'll try to get some measurable outcomes. I'll use the goniometer. I'll check those joints and see what the range of motion is before I start using my laser and augmenting them with MedcoVet Luma or using MedcoVet Luma. So I want to see those outcomes. I want to see that those joints are getting better range of motion.
We've touched on, a lot of the merits of red light therapy, laser photobiomodulation, specifically as it relates to the MedcoVet Luma, as that is the device that all 3 of us, I think, are most familiar with. As we wrap up, Kathy, do you have any other particularly memorable success story that you want to share? Or Alon, do you have a moment that tugged at your heartstrings that you'd like to tell our audience?
So I have one that's not as clinically sound as you guys, because you're so good at the clinical part. But there was a time when our website had 3 testimonials, and it felt good to see that people liked it. And internally we said, I wonder if anybody else, we really haven't asked any pet owners how they feel about MedcoVet. And we sent out a message that just said, hey, would you mind providing a testimonial for MedcoVet? And I was shocked. I literally teared up when I saw some of these testimonials. People came out of the woodwork. We got over 100 testimonials, just boom. And it's my dog had an amazing quality of life before he passed, and he's back up and running again. I don't even recognize my dog. There were so many things. It was just that aggregate moment of all these testimonials coming in. I'm like, man, I had no idea that we had an impact on so many pets' lives. And that really knocked me over.
It feels good.
It really does.
Yeah, it does. I had a patient probably about a year ago now. I was called into to see this cat that had these ulcers on the back of her hocks. And they had been treating those ulcers for over a year with very limited success. And they called me in to take a look at them and see what I could do. And I consulted with a neurologist who said, you'll never be able to heal those. Those will never go away. And it did take a while. I would say it probably took a good 5 months. But after a year and a half, she has no more ulcers on those hocks. They are completely 100% healed, and they've stayed healed. And so for me, that was such a great moment, because this poor cat was walking around with socks and bandages and ointments and now she doesn't. Now she's just a regular cat.
Well, and you raise a good point, Kathy, because, we're focusing on arthritis for the purposes of this show, but I know that the top 3 diagnoses that MedcoVet Luma effectively treats include intervertebral disc disease as well, and wounds.
Right.
So sometimes people forget, I remember one dog, we were treating her elderly shepherd mix, for arthritis, and in communication on the app, she mentioned that her other dog, had cut its paw pad pretty severely on some ice. I think they live in Michigan or something. And I'm like, well, use the Luma. And she's like, what? I can? And I'm like, yes. It helps so much with wound healing. Yeah.
Right. Same thing. I had a patient that had a dentistry the other day, and they're like, oh, her mouth is so sore. Get out that Luma.
Yeah. And it really is, an investment. This is a workhorse. There's a 2-year warranty. And if you, whether you're using it, for one pet now, if you invest in the MedcoVet Luma, it's going to last, and, it'll be there for your next pet. If you're always going to have pets in your household, I do think that this is, again, just such a great tool without side effects. And, I just wanted to, we kind of touched on the cat thing. And, this is a population of pet that has a high prevalence of arthritis as well, particularly in the lumbosacral spine. And we're just starting to recognize it because cats are so crafty at hiding their pain. So research has shown that over 90% of cats over the age of 12, and these cats now are living to be 20, 25, right, no problem, have OA somewhere. Mm-hmm. So, we've talked about all the different things that can help, but if there's just one thing that almost every pet is going to get, it is osteoarthritis.
Alon, I know we touched on this a little bit, but I'm wondering if you can actually tell us how long should we expect to wait to see results in a patient with osteoarthritis? 2 weeks, 4 weeks, 6 weeks? Is there a time frame?
So you should see results in about 4 to 6 weeks. What we like to do is after about 2 weeks, the clinician will take a look at the protocol and how your pet is responding, and they can change the protocol to see if they can get to healing faster than that. But usually we see about 4 to 6 weeks before you start seeing improvements in mobility and energy and things like that.
I can't tell you how many pet parents, we have this conversation, right? And then they'll message me on the app and they're like, we've used it for 5 days now and I'm not seeing any results. I'm like, right? That's exactly, stay the course. And, and oftentimes following those World Association of Laser Therapy guidelines in terms of protocols, it is just a matter of staying the course, I have found. There's not a whole lot of latitude. You mentioned we may add a spot, subtract a spot, increase by 30 seconds, maybe, decrease the frequency or bump it up again, if they're having a flare, because arthritis tends to ebb and flow. So, right, you may be in a good spot and then something happens, maybe they even, sleep on the floor and they're used to sleeping in their bed and they wake up particularly stiff. Well, bump up the treatment again a little bit to help them get past that.
Yeah, looking for a sweet spot is what I always say. And right now, with the change in weather, I see a lot of patients who are more stiff from their osteoarthritis and changes in barometric pressure. So I think it's important that you're right. It does sort of ebb and flow. And I feel that with my own osteoarthritis, right? And I can get up and go, oh, I think it's going to snow today based on my knee. Same thing for animals. I think they experience that as well. I think they probably experience a change in barometric pressure on their body, maybe before we even realize there's a change in barometric pressure. So yeah, I think that's a good stay the course, is good for good advice for rehabilitation as well as, using red light therapy.
Alon, before we go, can you talk about some of the materials, assets, offerings that MedcoVet provides for pet parents?
Sure. Let's take an example. Like you have an arthritic dog, and the first thing that you'll get from MedcoVet is a consult with a clinician for 30 minutes. Where they'll help you understand what's going on with your pet and whether red light therapy is good, will actually help your pet. You also get, obviously, the MedcoVet Luma, which is the light source that's going to do the healing. And you also get an app, which does a bunch of things. It has a personalized protocol in there. The clinician, after talking to you, creates a protocol that's specific to your pet. And you can use the app to track your treatments, to monitor and track how the pet is doing, to communicate with the clinician. And the app is really the tie line between you and the clinician, and it's the way that you keep track of everything. And using that, it increases compliance. You have better outcomes because you have a clinician who's kind of monitoring and seeing that things are going well. So you get more like a holistic approach to this rather than just a handheld device. It really helps you attack the condition and, look at it where you have clinical eyes on it and you have tools to help you keep track of it.
We have a great team too. These are experienced clinicians. They're not sales pitched. We're not out there as salespeople. We're out there as actual practicing clinicians, sharing the experiences that we've had with red light therapy and why we like the MedcoVet Luma and why it might be beneficial for you or your pet.
Yeah, one of the interesting things is the consult is different than just about any other company. And we tried to track and to see if people are actually benefiting from the consult? Or to Kathy's point, does it just feels like, hey, how do I get you into a Luma today? Does it feel like a used car sales pitch? And we even get testimonials about the consult, about how good it is. If you think about a pet owner who's dealing with something that they really don't understand very well, and they need help, and they can either just Google articles or go to the clinic, which is, clinics do God's work, but they're so busy. So you really get a half an hour where somebody pays attention to you. It makes all the difference.
Right.
Well, and I also want to put a pitch in for the fairly recently revamped website. You've alluded to it, but there's blogs, there's research articles, all the specifications for the Luma are on there. You've taught us that, it's a red flag if you go to another vendor's website and you can't find the specifications.
Right.
We've also have a great team member who is doing such a wonderful job of curating, the experience of a pet parent that, maybe just starting their journey and wanting to learn a little bit more about, what is this red light therapy that I keep hearing about, to really delving into, more of the science and things like that. So she has developed a 22-minute crash course video tutorial with a accompanying workbook. And Alon, I know you've done a number of, like onboarding videos and things. And it's interesting because just this week, I knew we were interviewing you today, and I've had one actually works at a vet office, and she's like, I need hand holding. She's like, I've know about this. Everybody says red light is great, but I don't know really anything about it or how to implement it. This woman has 10 pets. I think she should,
Wow.
I got you, lady. I got you.
Yeah.
I'll take you by the hand. Yeah, I'll
there's
take
a
you by the
variety.
hand.
Yeah. There's a variety of methodologies, and trying to really meet our listener, pet parent, where you may be in your journey. So please go to medcovet.com, which is the website, and you'll find a lot of information there.
And book a consult. It's free. You'll learn a ton. And our clinicians are really nice, and they can't wait to talk to you.
We are excited to talk with you. Actually, there's nothing I love more than hearing about people's pets. I really do. I really do enjoy that aspect of it and seeing them feel better. So thanks, Alon. Thank you so much. Thanks for putting your trust in me and Chris and the whole team. And thanks for putting out a product that we can all be proud of. So thank you.
Hey, it's been an absolute blast. Thanks so much for having me.
Before we go, are there any, do you have any insights or secrets about the future of the industry? Anything coming down the pike that we can get our audience excited about regarding red light therapy?
I know it's very buzzwordy, and I almost hate to say it, but there is opportunity to really, as we get more cases and as we start to get a bigger set of information, there's an opportunity for AI to really personalize treatment. So in order for AI to work, you need big data sets. And we're now starting to make a bigger and bigger and bigger data set. And all we're going to use it for is to help get the right protocols and make sure that pets are getting the right treatment. I think I call it like mass personalization, where everybody gets a really, really personalized treatment that's specific for their pet.
And AI is here, and it's only going to be more and more in our lives. So, that's
absolutely
one of the things about this company. And I tell people this all the time too. I said, founder of this company had the vision, before COVID, the pandemic, knowing that telehealth or telemedicine was going to be the wave of the future. And you need technology in order to implement that. And so, congratulations, you succeeded, and we're just on to the next steps, hopefully.
Well, you can congratulate yourselves as well. You guys have been part of the journey. I couldn't be here without you guys.
So before we close, Alon, can you give the website one more time?
Sure. It's medcovet.com, medcovet.com.
Great. Thanks so much.
Thanks,
all right.
Alon.
Thanks, guys. Take care.
You too.
Hi, Petability fans. This is your host, Kathy Simons. Do you live with a blind or visually impaired dog? Don't let vision loss stand in the way of a full, joyful life. In my book, Blind Devotion, Enhancing the Lives of Blind and Visually Impaired Dogs, I share my expertise and passion to help pet owners like you navigate life with a blind dog. From adapting your home to building trust and confidence, this book is your go-to resource for ensuring your furry friend thrives. Your dog's vision may be limited, but their potential isn't. Empower your dog. Get Blind Devotion today at Amazon.com.